Welcome,
Good evening.
everyone. Oh, I'm sorry. Let me introduce you, Dr. Board President. Welcome, everyone, and
All
thank
right.
you so much for joining us for our 6 Feet Apart, Stronger Together pledge to protect our community. We're so happy to have you here. And as of right now, we have 127 and climbing participants. So we ask that you take a comfortable seat. We're going to have a very candid community conversation, almost like a fireside chat. And we're going to start now with none other than our board president, Adrian Conacher-Macklin.
Thank you, Mr. Unaka, and welcome everyone. I'm so excited to see everyone here tonight, and we really thank you for joining with us to talk about COVID. You know, it's often said that different lives matter. Black lives matter, all lives matter. And that really underscores one thing: thinking minds matter, and the community mind matters. And what that means is that when we think together, when we collaborate, when we operate as a community, when we get input from everyone, when we talk about what's going on, we succeed together. And what we do on this call is actually going to help us shape how we respond, get genuine input from our community, hear from experts, and know exactly where we stand as a community once we banded together to deal with COVID-19. Needless to say, it has hit us all in very different ways. For me, as a school board member, it has certainly been heart-wrenching to see our students not be able to really learn from their wonderful and magnificent teachers whom they've grown accustomed to having and seeing every year. For parents not to be able to have adequate childcare and having to choose between employment and staying at home because it's just not safe to bring children back yet. And for our communities devastated by COVID-19, businesses folding, homelessness rising, food insecurity, home insecurity, you name it, we have it. But we know together, along with all of our numerous community partners, and we certainly thank the Senator's office and the Assemblyman's office, as well as everyone represented on this line, for being here with us tonight to think together. So thank you, Mr. Unaka.
Thank you so much, Board President Conacher-Macklin. And I'd like to also invite Dr. Roberta Perlman to greet our now 238 individuals in climate. Dr. Perlman, please unmute.
Sorry about that. My computer wasn't responding. Good evening, everyone. Thank you so much for attending. I just wanted, I'll just very briefly say that during this holiday season, I ask all of you, our wonderful Pomona, Diamond Bar families, as well as our friends in surrounding cities and counties, to make a pledge to keep our region as healthy as possible as we try to return our children to school and our parents and families back to work. Until our children get back to school, our community won't be right. So we have to get our children back to school. It's so important. There are many things we can't control, but we can do a lot to limit the spread of this virus. Please do your part to keep those around you safe. Keep yourself safe, your family safe, and your neighbors safe. So during these uncertain times, there are certain things that we can do, and let's try to do them together as we work through this very, very difficult time that we're all going through. Thank you so much for attending and being here to this is the very beginning of doing your part. So thank you so much.
You got it. Thank you so much, Dr. Perlman. Board Member Guzman, would you like to have words, sir?
Sure. Thank you so much for joining us this evening. You know, I think Adrian Conacher-Macklin put it very well in expressing how we have to think together. As someone who's experienced COVID firsthand, who's had it, who's been in those trenches, it's very important that we do our part to make sure we educate one another on how we can keep safe, how we can keep others safe, and how we can help each other in this time of need. And I don't think I've met anyone who hasn't been affected in some way, shape, or form by COVID. And so I'm ready to learn together this evening on what we can do And I am definitely in with this pledge. So thank you.
Great, thank you so much. I'd like to take this opportunity before opening it up to our electeds to just really thank all of our panelists for donating your time to this very important community conversation. I want to be mindful of time, so I'm just going to issue a huge thank you to all of the prestigious names here, and most importantly, to the 249 participants that are on the other side of this wall. At this time, I'd like to bring forward Elise from Supervisor Hilda Solis's office. Elise, if you would have words, please unmute.
Sure. Thank you, Oliver, and thank you all for inviting me. And the Supervisor Solis asked that I provide brief remarks on her behalf, and really just want to take the opportunity to thank you all. These last several months have been incredibly challenging, but the San Gabriel Valley, the Pomona Unified School District, all the cities have really time and time again stepped up and met the moment. We know COVID-19 has had this immense impact on families and students. And I want to extend Supervisor Solis to you all. She wants to make sure you are getting what you need, support, mental health support, any learning support you may need, access to testing, resources. Please feel you could reach out to myself to make sure you are getting those services. And just really want to thank you all for taking COVID-19 seriously, hosting this event, because we are all stronger together. We're seeing an increase in cases, but we know we'll get through this period and come out of it stronger together. So thank you on behalf of Supervisor Solis.
Thank you so much, Elise Weinberg. We really appreciate you stepping in on behalf of the supervisor's office, who's a great partner, by the way, to Pomona Unified School District. Quick housekeeping announcement. We have both Spanish and Mandarin interpretation available. If you would click on the globe where it says interpretation, we have both those services available simultaneously for our parents who prefer either Spanish language or Mandarin. And at this time, Andrew, on behalf of Assemblymember Frederick Rodriguez, thank you so much for joining us. And please, we invite you to have a few words.
Hello, everyone. Thank you for having me here today. I appreciate the opportunity to speak on behalf of Assemblymember Rodriguez, who knows how important it is to be mindful when it comes to the health and safety of ourselves and others, especially right now. And thanks for everyone in doing their part in our fight against COVID during such difficult and challenging times for many families. And the Assemblymember would like for everyone to know that our office is ready to provide assistance or support wherever necessary, and we'll encourage anyone to reach out if they have any questions. Thank you.
Andrew, thank you so much, and please give our best to the Assemblyman. Mr. Martinez, at this time, I would call you forward, sir, and if you would mind just sharing with our participants the community impacts of COVID-19 and what you see as our collective responsibility. Mr. Martinez, you're muted, sir.
It's only been 8 months and I never get this right. I just keep myself on mute. Mr. Yanaka, just out of respect to, I follow chain of command. I know we've had our Board of Education that has spoken, but I believe the Senator is in the House, and I'd like to defer to the Senator first, unless you have another plan.
Well, we have her on the agenda, but obviously we will take this time and follow your lead and welcome none other than our very favorite Senator Connie Leyva. If you would just have words, and we will fall back into the agenda. We have you scheduled for part 2. Senator Leyva, please feel free to unmute.
Thank you very much. I will just say good evening. Happy to be here, and I will follow the agenda. I know when I'm supposed to speak, but Richard, you're always too kind. So thank you very much, and happy to be here, and I'll have a few more things to say later in the agenda.
Thank you so much, Senator Leyva. As always, you're an amazing partner. Mr. Martinez.
I apologize, Mr. Yanaka. I just don't like our folks and our guests waiting.
Sure.
So I appreciate that you've already connected with the Senator. I'm the last one to know that piece. So I want to thank everyone for being here, all those leaders, all the leaders that are in front of us. But I know we also have leaders that are part of our participant panel. And so I do know we were up to a few hundred on that side of the wall. And I want to welcome you tonight, and I want to thank you for taking this evening to our influencers, our leaders, our neighbors, our business partners, for coming and joining in, because this is a message that is for everyone in this community. Anyone that touches a child, a family, any resident of this community, it's important that you hear this. But not only hear the message, but spread the message. So you're going to get some information. We're going to have some slides for you. So it's important for you to not only listen and then go away, it's listen and do something about it. And we want you to teach others. So I implore you to do that. So I want to thank our leaders that are here. You're not going to hear from everyone. So all those that are participating on that other side of the wall, don't worry, not all 38 of us are going to be speaking. There's only going to be a few of us that are speaking, quite a few of us, but we are going to make this as interesting as possible. But it is a message of hope, but it's also a sober message of where we find ourselves today. But there is hope and there's a light at the end of this tunnel. And we want to make sure when we get out of this tunnel that we're going to bring our families along, our children along. You're going to hear from a couple of students a little bit later towards the end of this presentation. And they're going to talk to us about why this is so important that we collectively come together to support them. These are seniors that want to graduate in front of their parents, not on Zoom. They want to be in a place where they could be hugged, where they could be celebrated, and I want them to. The board members, all of you want to see our students walk. We have the opportunity to change what's happening by our actions. So you're going to hear that tonight, and I really want that to really get home, and I want to hit that home because we've lost some people in this town. People have passed away with COVID-19. Many of you in this call may have been impacted by this. You lost someone in the hospital, you couldn't be there with them. And so we want to make sure that we don't have any more cases like that. And our prayers and our condolences are with you and your families that have gone through that. So we gather remotely as residents and business owners, regional and state leaders, to learn together, to commit to a pledge. And if you know what a pledge is, it is a promise. I wanted to use the word covenant, but I figured that's probably a little more too religious and some people may not like that, but it is a promise. And if you know Scouts Honor, it's something we want to move forward and go out. So after making the promise, we want to get ready and be the example. And not only talk about it, but also be that example. So what you learned tonight, we'd like you to take it out through your actions and share with others. So this all was birthed, this conversation, this discussion, and why we're meeting, by some friends of mine, Julie Robert Frank and Rebecca Gifford. These two individuals are part of a larger group, ICON, the Inland Communities Organizing Network. And they approached me a few months ago. And they said, can we get ready when students return? Can we help spread the word that we could stop this, that we could stop the spread? I didn't like using the word slow the spread. It's stop the spread. We have proven that we can do this by putting masks on, by practicing safe distancing and the protocols that the CDC has given us and Department of Public Health. So we want to make sure that during this holiday season, and that's why it's happening today that we're meeting, Thursday, right before we enter 1 week that we're going to be off for Thanksgiving. And unfortunately, we can't come together like we normally do with large groups. It's going to be a very small group. But it's so critical that we follow these rules to ensure whatever happens here in the next few days, because I know new rules of engagement will be given to us by Mr. Connolly's office, by Department of Public Health, by the State Department. So we want to make sure that we do everything we can to celebrate, to be thankful, to be grateful for everything we do have, but also to plan to have a great holiday season, a safe holiday season. So I wanted just to share that with you. This is a message of hope, but it is also a very sobering message that we want to share with you first. And then there's a call to action at the end of this meeting. And so with that, Oliver, I give this back to you because I don't want to take over this meeting, and you'll take it from here.
Mr. Martinez, thank you so much for that. And we really, really appreciate you sharing the community impacts of COVID-19 and our collective responsibility. Julie, Mr. Martinez touched on ICON, and this has been, dare I say, a labor of love, be it with you, Rebecca, and others. Would you mind sharing with us the concept and the importance of community support and really ownership of this message of stopping the spread?
Thank you, Mr. Unock. Thank you, Superintendent. ICON is a number of institutions in the city and the western end of San Bernardino County. I serve also as pastor of First Christian Church of Pomona, one of the pastors there. We've been here, the church, since 1883 in the city, invested in its well-being, and we are on a stormy sea together right now. And all of us here tonight have been rowing furiously since the pandemic began. And Superintendent, you immediately recognized why we need to have an all hands on deck approach to this crisis when we spoke last June. The district can do everything in its power to keep students and staff safe while they're in school. But if the community in which they live and work isn't also rowing in the same direction, we're just not going to make headway. Whether in our congregations, our businesses, our neighborhoods, our families, we need to all be able to count on each other to do our part. We got to have each other's backs. You knew, like us, that in addition to all the wonderful resources being rallied to meet immediate needs by our city, by our county, by countless nonprofits in this city, we also need a strategy that encouraged everyone to get on board, to learn the facts, to teach others and tell the stories and take action. We congratulate you, we thank you, and this amazing staff at PUSD for kicking off this campaign to save lives, the lives of our family members, our neighbors, and our friends. Thank you.
Thank you so much, Julie, for that. We really, really appreciate that. Shirley, we have 303 participants at this time, but many of them are parents, and the parents have burning questions. What are we doing to ensure the health and the safety of our students, of our staff, and of our parents? And as our district COVID compliance officer, if you do us a favor and provide an overview of what we do here at Pomona Unified School District.
Well, thank you, Mr. Unaka, and good evening, everyone. It's a pleasure to be here with you. I'm a retired principal from PUSD, and I've had the privilege of coming back and working with staff and being part of this crusade to get all of our school sites ready for when and if our students come back, and to keep all of our employees safe. So I'd like to tell you a little bit about what we've been doing here in PUSD to get ready, get our school sites ready. Each one of our school sites and each location, whether it be the village at Indian Hill, or it might be the Ed Center or the Mendoza Center, we have liaisons, a person that's assigned to assist in implementing all the protocols that are laid out by the LA County Department of Public Health. We are trying to keep everyone in the district as they enter into our facilities safe. All of our liaisons have been, and administrators have been trained in COVID-19. They have been trained on how to screen people as they come in and out, and been trained on how to remind them to stay 6 feet apart, and trained on how to keep their mask on, and show children how to wash their hands and use hand sanitizer. So we have done a lot of training with our liaisons and our school site administrators, as well as the district level administrators here in the district. Our maintenance and operations department has worked tirelessly in getting everything disinfected, getting shields up on desks, and making sure we have all the personal protective equipment that we need for not only our employees, but for our students and for our parents and our visitors when they come to our sites. So we have really taken a lot of time a lot of effort to try and make it a safe place for your students. Now, I'm a grandmother, and when I look at each one of the sites and I talk to each one of the people, I think about my grandchildren, and I think, is that good enough for them? And if it is, then it's good enough for your children as well. So I'm pledging to stay on board this ship and be one of the rowers that is going to get us through this storm. And so when you ask yourself, parents, are my children going to be safe when they return to school? I have to tell you, the answer is yes. We are taking every step we can to keep your children safe. And so with that, I just want you to know that the district is providing not only the PPE that your children will need, they will have hand sanitizers. Their teachers are going to be trained on how to interact. I know it's not going to be that, you're really doing a great job and patting them on the back. We can't do that right now, but we want them to feel safe. Teachers and students will be provided with those face masks. They will be instructed on how to use those face masks. And every person in this district, from the superintendent, our Board of Education, and our parents, teachers, and administrators are on this ship to try and make sure that our students get the education that they deserve.
Shirley, thank you so much for that. Just as an aside, we joke with Shirley all the time because since I've been here in 2016, I think, Shirley, you may have only been home probably about 2 weeks, and we joke with her that she's failing at retirement, but she's doing it to ensure that our students are succeeding in classrooms and everywhere else. So, Shirley, we really thank you. Thank you so much for that.
Thank you.
Now, you talked about students. I want to change gears just a moment, and we have one of our stellar students here, Caitlin Wynn. And Caitlin, we'd like to hear from you. We want to hear a student's perspective on the Stop the Spread pledge. What does that mean to you as a student? Please share.
Good evening, everyone. My name is Caitlin Nguyen, and I am a senior and the Associated Student Body President on my campus at Village Academy High School. Reactions to the coronavirus has caused great changes to daily life, especially for students. School provides students with a structure and routine. Not only that, it is also a place where students have social interactions, and students all across the state and PUSD are eagerly waiting to go back to school and have a sense of normalcy back in our lives. We are waiting full of hope to come back to campus, but most importantly, we want to come back when it is safe and reasonable to do so. Many of our students, like myself, live with high-risk patients, like our grandparents or guardians that are battling cancer. And due to that, we want to make sure that when we do adjust to the hybrid schedule, that we're also making sure to keep those close to us safe. As students, we are united in taking the pledge to stand together 6 feet apart. The senior class of 2021 are eager to take the pledge in hopes that we could flatten the curves so that we could take hold of what we have left of our senior year and to enjoy every last minute we have as high schoolers. We want to have an in-person graduation so that when we walk up on stage, we could look out into the crowd and see our families and enjoy the last moments with our fellow peers. Most importantly, we want to be the last class that is affected this heavily by the virus because we know how much our underclassmen peers are looking forward to the memories of senior year, which they have worked so hard for. We need to come together to make this happen. We each play a part in what happens next in this crisis. We can either add fuel to the flames of this virus, or we can be the ones carrying the buckets of water, the ones easing some of the pain. We want to be the ones easing the pain in our community because we have the power to save lives and to prevent unnecessary suffering in our community. If we simply do our best to care about others. So let's shift our values from me to we. If we can each be a little bit more compassionate and caring, we will do our part to put out the fire. And I understand that it's hard when no one is forcing people to stay inside or at home. And I understand it's tempting to have friends over to go out and grab drinks or food. And it's easy to just revert back to normal living, but we need to think of all the vulnerable people who are counting on us to protect them. and all the students who are counting on us to get them back to school and get them that education that they so desperately miss. Because as a student, I'm really missing my fellow peers and walking around the halls and just enjoying my final moments. Thank you.
Thank you so much, Caitlin. We really, really appreciate that. And Alec, my friend, please unmute and let us know, also from a student perspective, what call to action do you see being important when we talk about community-wide health and safety standards and procedures? Why is that important to you?
Hello, everyone. So my name is Alec Hernandez. I am the ASB president at Gary High School, as well as the student representative on the Board of Education. So as a very school-oriented student, it is very hard for me to sit inside and sitting here having to stare at a screen for so long and getting my education like that. As for what the entire school and community needs to do is we just need to stay inside. I think it is very important for all of us. And just to be able to have our last final moments at our high schools, it is very difficult for all of us. I know it's very difficult for all of us to be able to sit inside and just focus on the protocol and kind of just stay here in our very unstable background, because I know for many students, it is very hard for us to sit inside and kind of very difficult for us to stay in a single environment. So I think what we need to do in order to stop the spread and for us to have students experience that homecoming, the prom, the graduation, to walk on those final steps into getting our diploma, we all just need to be able to pull our part and sign the pledge. I think it is a very important thing for us all to do, because it's inspiring the rest of the students that, hey, we have your back. We are here right next to you. We are supporting you through this very difficult and tough time. And I think as parents just need to, parents and the community just all need to fasten their gears and be able to stop the spread.
Thank you so much, Alec. You know, it's so easy to call on you too. You make us so proud. You know, Connie Leva, Senator Leva, he reminds me so much of your Senate Bill 532 that ensures stronger student voices on school boards. So, you know, we sort of put him out here because he's the embodiment of such great legislation. So thank you both so much for that. Dr. Gluckstein, sir, as we close out part one, if you would end us on this note right before Senator Leva opens the second portion, if you would talk with us and provide an overview on the guidelines as you see them and local COVID-19 implications.
Sure. Good evening, everybody. I'm the medical director of infectious disease at Pomona Valley Hospital and have worked as an infectious disease physician there for almost 40 years. Clearly, as this started way back in February and March, we've developed a huge experience in taking care of COVID patients locally, nationally, and worldwide, and a huge body of literature about what works and doesn't work has evolved. And these have gone into what is sometimes frustrating, constantly changing guidelines about what we should be doing with our behavior, wearing masks, et cetera. And that's the nature of an evolving pandemic, that as we get better information, we have to change the rules a bit. And at this point, we're feeling pretty confident about some of the information we have. We now know that as part of both worldwide as well as national and state and local health department guidelines, it's really critical that we wear a mask that covers our nose and mouth when we're around other people. These really work quite effectively to prevent the spread of COVID, as well trying to stay at least 6 feet away from other people, and particularly when you don't have a mask on, or even farther. Any sort of gatherings that are necessary should ideally be outdoors and with people with masks and staying at least 6 feet apart. And certainly as we approach the holiday season, we know this is a very difficult time and people want to be around family and friends, but clearly with increasing cases of COVID throughout the country and in the local area, it's really important to try and limit your celebrations to your immediate family so that you don't have unrecognized contact of somebody with COVID, and particularly when you're most likely to be a little more relaxed and take off your mask. And that certainly makes the holidays difficult. Now we know better days are coming. So if we can get through the next few months, I think things will look a whole lot better, particularly as we get into the late winter and spring. We also want to emphasize, if you know you've been exposed to COVID, the quarantine requirement is generally separating yourself from other people for 14 days, because that's how long the virus could wait to start to make you sick and spread. If you do have COVID and you don't need extensive health care, then you want to be separated from people for at least 10 days from the onset of your symptoms, or if you really have no symptoms, from your positive test to prevent spread. And as long as you're feeling substantially better after 10 days, then you are no longer contagious. Speaking a little bit about what's happened at Pomona Valley Hospital, we are now approaching 1,000 patients who have been in the hospital at least overnight with confirmed COVID disease. And tragically, we've had over 100 deaths so far. And with all of those, it really pains us to see people get very sick and pass away at the hospital, and particularly when we've had to have severe restrictions on visitation due to the concern for ongoing spread of COVID. However, on the upbeat side, we've made enormous progress. We now have medications that we know work as far as Decadron and Remdesivir. We've given lots of people convalescent plasma at the hospital. Our critical care team and a lot of the things we do with the physicians, nursing staff, physical therapy, respiratory therapy are very different than what we were doing back last spring and late winter. And we now feel the hospital is safe for care for people with COVID, and as well people who need medical care and don't have COVID. We know you shouldn't put it off because you're worried about acquiring COVID. And as well, seeing people in medical offices and clinics is important to your health ongoing. On the really good news side, just in the last 2 weeks, the data coming forth on vaccines is really incredibly hopeful. Vaccines could have been potentially approved with 50% success, and with vaccines so far, at least 2 to 3 candidates showing 90+% efficacy in preventing symptomatic disease is a true home run. And we await some further safety data. We all expect we will start to see some authorizations from the Food and Drug Administration late this month or early next month, and then further governmental review by independent vaccine review committees. And we will probably start to receive some vaccine towards earliest, maybe mid-December, but probably late December, and then increasing amount spreading out through the community into January, February, March, and then onwards probably to midsummer next year. And so that's where those will probably make a huge impact in the ability of the virus to spread and provide us with immunity from this horrible disease moving forward. So if we can get through the next few months and limit the number of people getting sick, we can hope to, as the students have said, think about students in person graduating, interacting with their peers and family and friends, and looking forward to a much more normal school year later in 2021. And I think just long term, this is certainly a once in 100-year pandemic. And as we think about what we're going to tell our children and grandchildren about the COVID-19 pandemic of 2020, 2021, they'll want to know what you did to protect yourself and other people and what it was like. And what we do in the next few months is going to be critical for the health of all of us and returning to what we all want, a much more normal life without all these restrictions. But for the next few months, those are going to be critical until we see these other advances start to really spread and benefit our community. Thank you.
Dr. Gluckstein, thank you so much for that. Your overview is so timely because, as I mentioned, we separated this presentation in 3 parts, and you ended the portion that explained where we are, right? And what we were hoping to do for the benefit of not just our panelists, but really our audience is not to just pronounce doom and gloom, because there is hope. And your segue is ideal. As we move over into part 2, under the banner of Stop the Spread, we're now interested in what the call to action is. So we call on a few of our elected leaders who exemplify servant leadership. We look at individuals like Dr. John Connolly, who represent strategic approaches to combating COVID-19. This is where we start to move to the better news. And Senator Leyva, if you wouldn't mind, as we shift to part 2, if you would share with us individual responsibility as you see it, and the community action to combat COVID-19 from your perspective.
Almost forgot to unmute. Thank you, Dr. Inaka. And thank you to everyone. Thank you to all of the participants that have tuned in tonight, because you are concerned about not just yourselves, but about your family and about your community. I want to say thank you to Caitlin and to Alec. You know, our students give me hope for the future. I like to tell them, we have screwed up the world. You guys have to unscrew it up. No pressure, but I know you can do it. And Dr. Gluckstein, I want to say thank you so much, because we hear a lot of national news, but it's really great to hear what's happening in our own backyard. So thank you very much. And I am very hopeful. I know that we can stop the spread. We cannot control what is thrown at us in life, being this 100-year pandemic and virus. No one could have stopped that from happening, but we each have the power to stop the spread. We have the ability to do the right thing. We can all wear a mask when we go out in public. My husband likes to tease me. He says, I have a mask addiction. And I said, well, if I have to wear a mask, they have to match my outfit. So we can do that when we go to the grocery store. I wear a mask when I'm on the Senate floor, when I'm speaking. We can do this. We can stay 6 feet apart when we go to the grocery store, and we can make sure that we're washing our hands. I like to joke, kind of, maybe I didn't wash my hands as much as I thought I was before this happened, but I sure do wash them a lot now. And I count to 20 every time and make sure I get my thumbs, but we can do this. And something that Caitlin said that is so true. It's not about the me, it's about the we. Maybe I, Connie Leyva, am gonna be okay, and maybe I can resist the virus, I don't know. But God, wouldn't I feel terrible if I gave it to someone else? I haven't got to spend time with my parents who only live, I live in Chino, they live on the other side of Chino. I haven't spent time with them since March. I dropped things off on their front porch. And they're in their early 70s. They're very healthy, but we want to keep it that way. I drop things off on their porch. We'll have a little quick porch conversation with our masks on, but I want to make sure that I get to spend 20 more years with my mom and dad. So we won't be celebrating Thanksgiving together this year, which is a little disheartening, but for me, it's about the big picture, right? And it's about looking at our seniors who want to walk and graduate, about being able to celebrate Thanksgiving in July, maybe if we don't get to do it in November with our family, but we can do this. We each have the power. Wear your mask, and don't let anyone make you feel bad about wearing a mask. Sometimes when I'm in the grocery store, I'll see someone who is giving the checker a hard time, and I'm in a different position as a state elected, and I'll tell that person, you know what, don't give them a hard time. You want to be mad at somebody, be mad at me. I'm part of the government, and the government in California right now is mandating the wearing of masks. Don't give that employee a hard time. It's not their decision. They're just trying to abide by the law. And many of you may have seen today that the governor announced a modified stay-at-home order from 10 p.m. to 5 a.m. because we do know that the spread of COVID has gone up in the state of California. But again, we can do this. We can mask up, wash our hands, physical distance, and stay home as much as we can. Only go out for the necessities or of course to go to work. And if there's anything Team LEVA can do, please reach out to us. Our district office is in Pomona. Give us a call and we're here to help. But we can do this and better days are ahead. Thank you.
Senator Leva, thank you so much for that. And my takeaway there is we can do this. And our next presenter, Jessica Duncan, is going to tell us exactly how we can do this. Jessica's going to share a presentation from Western University. And Jessica, please take it away because what you have to share, as I mentioned earlier, is so very critical, and we're thankful to you for this.
Thank you for the introduction, and thank you everybody for having me here. Is the presentation going to pop up?
It is.
Oh, it is. Okay. Thank you. I think we need to go back one slide, please. Thank you. So as introduced, my name is Jessica Duncan. I am a registered nurse, and I'm also a graduate student at Western University of Health Sciences in Pomona. Thank you for having me here again. I am excited to work with you all in educating and motivating everybody in the community towards following these basic safety practices that can really help stop the spread here in our community. Next slide, please. So throughout this presentation, we will go through the basics of COVID, what we can do to help prevent the spread of the virus, when and how you should get tested, and resources available to the community. Thank you. So what is COVID-19? COVID-19 is short for coronavirus disease 2019. It is a highly contagious respiratory illness that can spread from person to person. COVID-19 is caused by a new coronavirus that was first identified in an outbreak in Wuhan, China. How do you get COVID-19? People of all ages can contract this virus. Children are not immune. And I think this is something really important that we need to talk about in the community. Anybody can get COVID-19 if you come in contact with somebody that's infected. If they cough or sneeze directly on you, or if you touch a surface that has these respiratory droplets and then go touch anywhere on your face, really, especially your eyes, nose, or mouth without washing your hands. So here we have 5 basic things that we can all do to help stop the spread. As mentioned before, we want to make sure that we're always wearing a mask in public. We want to stay 6 feet apart, even more so without a mask, avoid crowds, frequently wash your hands, not touch your eyes, nose, or mouth, and keep objects and surfaces clean. Okay. So what type of mask is appropriate? For the general public, you want to stick to a cloth face mask. That is appropriate. Anybody over the age 2 should be wearing one. You want to make sure that the cloth face mask, whether you make it at home or purchase it, has 2 layers and it is washable. You want to make sure that the nose fits snugly over the mask fits snugly over your nose and your mouth, under the chin, and also along the sides of your face. You want to make sure that you can breathe comfortably and either discard or wash the mask after every use. So here we have a good visual of several ways that you should not wear a mask. As I mentioned, it needs to cover both your nose and your mouth. These other scenarios that we see here, we often see people in public wearing them under your neck, your forearm, dangling from an ear on your arm after they've already used it in public. The problem with this is that if there are respiratory droplets on it that have COVID, it can possibly infect you, surfaces, and other people. Okay. So there is a proper way to wash your hands, and that is very important in getting ridding of the virus particles from your hands. And here we do have a demonstration from YouTube that I like. It's called the purple paint demonstration.
Let's start with soap in the palm of our hands and then begin to rub in between like so. But as you see, there is no soap on the back of my hands. So I'm going to interlace my fingers palm to palm. And then I'm going to do the same technique on the back of my hands with each hand. And then you're going to take the back of your fingers to opposing palms with fingers interlocked. And then start rubbing your thumbs. And then you're going to take your fingertips, clasp the fingertips in the right hand in the left palm, and vice versa. Rub your wrist one last time to make sure your hands have been completely covered in soap. Thanks for watching.
So if you cannot wash your hands, for example, when you are leaving the grocery store to enter your car, it's important that you do use hand sanitizer. You want to ensure that the hand sanitizer that you use has at least 60% alcohol. You're going to follow similar steps that you do when you're washing your hands, making sure to cover every area of your hands, including your fingers, your wrists, and focusing on the thumbs, the same way that you saw in that video. You also want to make sure that you keep rubbing your hands until that hand sanitizer is completely dry. So we want to clean frequently touched surfaces such as doorknobs and handrails often. We want to make sure that we are cleaning them with disinfectants that are approved, that have been proven to kill the coronavirus. There is an extensive list of these disinfectants on epa.gov. Symptoms of COVID-19. There are many symptoms and they do vary from person to person. And one person may get all of these symptoms while another one may just have one, such as new loss of taste or smell. These symptoms include fever, chills, headache, body ache, fatigue, a cough, sore throat, difficulty breathing, new loss of taste or smell, congestion, nausea, vomiting, and diarrhea. Some people may also never experience symptoms, and they can give it to people without ever knowing they were infected. Who is most at risk for complications? Older adults specifically tend to be, have shown to be more high risk of severe illness. So people over the age of 85, this is the highest risk population for severe illness if they do contract COVID-19. People also at high risk are those with underlying medical conditions, and this can be somebody of any age. If they have diabetes, cancer, heart disease, kidney disease, high blood pressure, they want to be extra cautious. The CDC has put out a guidance for large and extended families living in the same household. And I think this is really important for our community, being that there are a lot of households that have many, many family members. Some people have more than 2 people in a room. If this is the case, we do want to act, we want to be even more cautious than we normally would. In addition to following all of the basic precautions, such as avoiding crowds, washing hands often, wearing a mask, we also want to think if anybody in the house is of high risk, someone over the age of 65 or somebody with an underlying medical condition. If this is the case, everybody in the household should act as if they are also high risk. You want to make sure that they're cleaning the house a lot, disinfecting it with those EPA approved disinfectants, avoiding close contact, such as if you have grandpa, you don't want to kiss him and hug him because of the risk. and potentially wearing a mask around that high-risk individual. Somebody that is younger and that's going to work, a high-risk place, they may want to just wear a mask around grandpa or whoever is high risk at home all the time. Avoid having visitors over at the house. And children, it is important that we also teach children how to avoid getting sick. As I mentioned, they are not immune. We want to teach them what is social distancing, how do you wash your hands properly, maybe show them that purple paint demonstration and do it at home. As hard as it is, no play dates outside the household, keeping them home. If they are over age 2, they need to be wearing a mask in public. I know this is very hard for children, so doing things such as phone calls or video calls, drive-by birthdays, people are getting pretty creative to help children throughout this time. If you do have anybody high risk in the house, it is really even more so important to know of COVID-19 symptoms and when to seek immediate medical care. If someone in the house has trouble breathing, persistent chest pain, they're unusually tired, confused, or have any blue discoloration to their face. If someone in your house does become sick, you want to try your best to keep that person isolated from everyone. In their own room, if possible, have a separate bathroom if that is possible, and only have one person care for that sick individual. If, for example, that sick person is sharing a room, and you can't isolate them, you want to keep them as far apart as you can. You can do things such as putting up a curtain, a physical divider in the room, and rearranging beds so that heads aren't close to each other. So dealing with exposure, how do we do this? The first thing you want to ask is, have you had any close contact with a person who tested positive for COVID-19? So a close contact, the definition has been changed a few times. A close contact is within 6 feet of somebody for more than 15 minutes, and this is over a period of 24 hours. I know before this was just 15 minutes at once, but the CDC has changed it. So it's really important we think of that. And this contact would begin 2 days before that person you were around became ill, or 2 days before they tested positive. And then you want to ask yourself, do you have any COVID-19 symptoms? If you have answered yes to any of these, you want to monitor yourself for symptoms. I want to add stay home and get tested. If symptoms do occur, if you haven't got tested already, make sure to do so and also stay home. So we want to talk about how long we need to stay home, which we'll do on the next slide. So quarantine versus isolation. I know there can be a lot of confusion about that. Quarantine is something you will do if you have been exposed to somebody who either thinks they are sick or has tested positive. Isolation, on the other hand, is if you yourself think you are sick or you have tested positive for COVID-19. So say you have been exposed to somebody, you're within 6 feet for more than 15 minutes over that day period. You do want to immediately start your quarantine period, and that is staying home away from anybody for 14 days. And this is after your last contact with an infected person. You want to get screened for COVID-19 and watch for symptoms of COVID-19. Isolation, if you are sick or think you are sick with COVID-19, if you haven't gotten tested, you should, and immediately begin your isolation period. So you will stay home at least 10 days since symptoms first appeared, or 10 days since you tested positive, and at least you have not had a fever without the use of fever reducing medication for 24 hours, and you are feeling better. Okay. And you want to try and stay in a specific sick room like we were talking about before as much as you can. Use a separate bathroom. And of course, stay away from anybody in both of these situations. Okay, so testing. There are a few local areas that do free COVID testing. These two specifically, what's wonderful about them is you do not have to have insurance. You do not have to worry about proof of citizenship at all. There are no questions asked. I did personally call both of these to ask about, just to verify there's no insurance or proof of citizenship. If you do have insurance, they will take it. If you don't, they both apply you for a temporary kind of insurance that is specific to COVID. So if you do, I mean, as far as the community, if you know, I think it's really important to stress that we do not have to be fearful of citizenship related to going to testing sites. We need to worry about health. There are no questions asked. And at the Fairplex drive-thru in Pomona, same situation. You do not need insurance. You do not need proof of citizenship, and it is free. Walgreens does do it. I believe, yes, you do have to show an identification there, and that one is free. We also have Rite Aid on the next slide. It is typically $0 out of pocket for most insurances, or they do have a federal program. So for people, like I said, that are really worried, I would stress the 3 first sites, call them. You have to make an appointment, but there are no questions asked. And I just think they're great resources for our community. Next slide. And how can we stay updated? We do have several different local websites, the LA County website, the Pomona Unified School District, and that is something that is good for parents. I know you guys everybody stays in touch for the most part, but staying up to date on what the changes are for the school when kids can go back to school. And of course, we do have the CDC, cdc.gov. You can get a lot of information regarding the new updates. So our main takeaways here, we'll just quickly go over those. COVID-19, this is a new virus. We're all going through this whole new pandemic together, which is difficult, but we are learning together. We are progressing. There is hope. We just all need to stick in this. A person, of course, becomes infected, respiratory droplets, and let's see, very important to know that a lot of people are asymptomatic and they can pass it on to other people. Symptoms range. It can be mild, it can be severe in others. Who's at high risk? Older adults and those with underlying medical conditions. Children can get this virus and pass it to other people. We do have ways to prevent this. Wear a mask, avoid crowds, wash your hands, clean and disinfect. And I don't think I mentioned before, but we want to make sure we're washing our hands for at least 20 seconds. And most importantly, everybody, as speakers before have said, we can do this. If we all stick together and serve as role models to others in our community, we can get through this. This will take a little bit of work, but I appreciate you all being here, and what a great turnout to see how many people are passionate and dedicated to turning the page on this.
Jessica, thank you so much for that. As you were presenting, I glanced over in the chat and saw a comment by our Deputy Superintendent, Mr. Darren Knowles. And I'm going to add you to that list. I'm going to take a personal privilege and add you to the heroes list. Darren sent a shout out to our very own Dr. Gluckstein, Jim Dale, hey Jim, and Pomona Valley Hospital staff, and you too, Jessica. You all are really heroes, and we thank you so much for that.
Thank you.
Dr. Connolly, you know, a wise woman once shared this with me, and I was probably too young to understand. And the secret is that wise woman was my grandmother. She explained to me, she said, a series of random and/or inconsistent tactics cannot be later confused or called a strategy. And so now I raise it up a little. I take us to the 65,000 foot level with the very important work that you do. And if you would talk to us about what does it take, these tactics that are being shared and that are posted everywhere that we go, how do we collectively pull that together so that we have a strategy to combat COVID-19 such that we can start seeing numbers trending in places like Pomona and elsewhere in the right direction? Please unmute, sir. We'd love to hear from you.
Thank you. Thank you so much for having me, and thanks to everyone for all the work that you're doing in partnership with us and each other to really stop the spread of COVID. This is an extraordinary moment, and I'm just so heartened to see the extraordinary actions of you all, and just thank the school district for having us here tonight to have this conversation and to educate the community and to empower and you know, move in lockstep with our community members in this effort. So Tonight, just in the spirit of what we're all talking about, I wanted to talk about efforts in two places that are really important to us in terms of combating the virus, but also reopening as we all work toward that goal. And we heard about the students really wanting to have the experiences in person that they've all looked forward to, and that we want them to have, and that we want ourselves, to enjoy as well. The first area is because this is a school-focused event, is schools, and what we're doing as a public health department focused on safe school reopening, in addition to businesses and other public places that we here at Public Health are making sure are safe for you all. So I'll start with schools, and basically hearing all of the really, I think, important comments from all of you about having access to schools and the importance of those schools, not only to our young people, but also to our communities and our families. And so we recognize the need to reopen schools in a thoughtful way, in a cautious way, and have started to do that with guidance from the state. So there are already four different activities for which our schools are open. And the first is to provide childcare, which is critical for school-age children with a school waiver from the state. That's the first activity. Number two is teachers and staff who are on site either to do teaching from a distance learning perspective and performing other essential operations. So there are other staff on site preparing meals, for example. Schools are just incredible hubs of services for our students. Other services like tutoring or mental health services as well. Tutoring in particular and other small group instruction can occur for students with higher special needs. That is another program that is available to schools, and up to 25% of the student body can be on campus at any one time for specialized services, assessments, instruction, tutoring, services and support of that nature. Third, youth sports, though no competitions can occur at this time. Drills and conditioning, that is allowed in cohorts. So all of these activities are in small groups and cohorts that are stable to prevent the risk of infection across different groups of students. That's available for conditioning and skill building, just to keep our young people active and engaged and social in a safe, distanced, and masked way. In addition, the fourth thing is also our waiver program, and a bit about that. So 50 schools a week can apply for a waiver across the county, and they can open from transitional kindergarten to grade 2 and bring back those full grades for instruction. Again, we approve up to 50 waivers a week for schools across the county, and they are evenly distributed across the supervisorial districts. We have basically been able, with that amount of waivers per week, been able to meet demand at this point. And we prioritize, it's important to note this, we prioritize schools with higher shares of students eligible for free and reduced meals. So that's another important program. So a variety of different reopenings that are happening at schools in a careful way, adhering to the protocols that we've put in place and that your school compliance officer described. And to make sure that this is safe, we work with school compliance officers across the county. We have, at this point, 30,000 staff back and almost 80,000 students back in schools already. And to ensure that those activities are safe, we are working with our technical assistance team, our school technical assistance team, going out to every single school site within 2 weeks of opening to review all of the reopening protocols with them, making sure that there are markings on the floor and signage to ensure distance, making sure that all of our young folks and staff have masks, that there's ample sanitizer and hand washing stations, that there isn't too much density in the halls or in classrooms, that cohorting is happening, looking at dismissal, looking at arrival, looking at how lunch happens, things of that nature. So just ensuring safety, and overall schools are doing just an amazing job of adhering to those protocols. And I have to also lean into this point a little bit before I move on to businesses. We have seen 263 schools experience cases. A handful of them have had outbreaks as well. So we technically define that as 3 or more cases. And so it's not uncommon for cases to occur, but what we're seeing is that in most instances, these are very limited situations in terms of a case or 2 or 3, maybe a few, But because of these careful protocols and the school's great work in adhering to them, we're seeing really, I think, a limit to the spread in school environments. And so I think that bodes well for the future as hopefully we stop this surge that we're experiencing right now. We saw roughly 5,000 new cases today. I know that Noel Barakat's going to talk more about that in a minute. We are in the midst of a really concerning surge, but hopefully we can keep our schools safe by adhering to the safety protocols. And so we've seen a great deal of that, I think, in our over 1,000 school site visits so far in the school reopening process. I'll turn a second to businesses. We also have a variety of activities going on to both support but also inspect and ensure compliance in our businesses across the county. Our environmental health division is hard at work every single day, including weekends, inspecting businesses to make sure that they are adhering to the protocols, both to keep you safe when you are in one of those businesses, in one of those public spaces, whether it be a grocery store or some other kind of retail environment, a restaurant, for example. That's clearly within our wheelhouse since we inspect restaurants regularly, but just making sure that things are happening outside with proper distance, masking, et cetera. And so they're doing that every single day, but also to protect workers. Many of us are still at work, still in the office, still in the workplace, manufacturing, factories, shipping, that's all still happening. And to make sure that those things are occurring with the proper safety, not only for the customer, but also for the worker, is incredibly important. When you think of all of that activity in combination with what happens in schools, just millions of people in this county still moving about to do their regular business that's essential and to go to school, the potential for spread of this virus is great. And so it's so important that we're ensuring compliance and our inspectors are doing that work very consistently every day. In addition, we have a safety compliance certificate program that provides technical assistance. In addition to the inspections and the compliance work that we do, we also provide that training to ensure that businesses are creating a safe environment, again, for their workers and also for the people who are in those spaces, in those environments. And so we encourage employers to participate in that program when they can, but also there is an enforcement side of things as well. And such that if any employers, or rather employees or consumers see concerning things, we do have a line for complaints. And I just want to put out that line right now. It's an important piece of our compliance work because this involves all of us. If you see something concerning, we do want to know about it. We want to make sure that there are safe spaces and we can reopen as soon as possible and to stop this surge. So complaints can be submitted anonymously to 888-700-9995. Again, that number is 888-700-9995, and that number is live from 8 in the morning until 5 in the evening, Monday through Friday. So I know I've certainly seen concerning sites in the community in terms of different folks not wearing masks or distancing in public places or businesses, and we just want to make sure that we're all doing our part to keep each other safe. It's a community effort. I think many of our speakers have said that today, and so we just want to ensure that we're all doing our part and encourage you to avail yourself of that line if you see something. So again, by working together, we can continue to implement solutions and take actions to keep us all safe and hopefully stop the devastating impact of this disease in our hospitals, in our communities, in our homes. And just want to say, from public health, our deepest condolences go out to those who have experienced a loss of a loved one or a friend and have suffered from this disease. So again, thanks for this opportunity to speak with you tonight. And with that, I'll turn it back to Mr. Unaka.
Dr. Connolly, thank you so very much. And I think that this is a perfect opportunity for Noel, if you would just discuss with us briefly regional health approaches as you see them. Please unmute and share with us.
Sure. Thank you so much for having me here today. And thanks, John, for giving some of the very important information that you provided around schools and businesses. I just want to thank you all for your leadership and initiative in the Stop the Spread pledge. This is such an important message and an important way to really get all of us engaged and participating and seeing what our roles and responsibilities are in helping stop the spread of this virus. It's been devastating. We are seeing an unprecedented rapid rise in cases. We really look at 4 primary metrics when we look to see how things are going, and as a county, how we are doing in slowing the spread of COVID-19. We look at the average daily cases by episode date. We look at the percentage of COVID-19 tests that result in a positive result, and the average daily current hospitalizations and the average daily deaths. And the current surge in cases is highly evident and is particularly pronounced since November 1st. We've just seen a sudden spike and a rapid spike in the last 2 weeks. And just in the last 2 days, we've had more than 8,900 cases that have been reported. That's a 2-day average of nearly over 4,500. And today we've had the single highest day of total number of cases in a single day with over 5,000 cases. We have not had that since the start of the pandemic. So we really are deeply concerned, are seeing this surge spike at a much higher rate, and we do need everyone's help in contributing and participating. Our positivity test rate was at 7.4% reported today, and this is really troubling evidence. We also are seeing increased numbers in hospitalizations, and today we report over 1,238 people hospitalized. And since the start of the pandemic, just looking at the city of Pomona, there have been over 7,300 cases reported in Pomona with 147 deaths since the start. Our hearts really do go out to all the loved ones who've lost family members and friends to this pandemic. And we do just want to continue to hold steadfast and take this very seriously. It is a very serious virus, and do everything we can. And as other speakers have said before, we can get through this. We can see a turn in this tide, and we just need to all work together. There are some safeguards that are going to get implemented starting tomorrow in support of some of the health officer orders. And both the governor announced some changes Saturday, and we've announced some changes tomorrow. Some of those are related to businesses that Dr. Connolly has mentioned already. And there are some things that each one of us can do individually as well. I'll just share with you some of the strategic business changes starting tomorrow for non-essential businesses that are permitted to operate indoors, including retail, store, offices, and personal care services. Occupancy is going to be limited to 25% of the maximum occupancy allowed. The number of patrons at outdoor restaurants, breweries, wineries will be limited to 50% of the maximum outdoor capacity. And several other places have maximum 50% occupancy. All of the details are on our website. Another notable change that will happen tomorrow is that restaurants, breweries, wineries, bars, and all other non-essential retail establishments must close at 10 p.m. So from 10 p.m. to 6 a.m. And I think the state's is 10 p.m. to 5 a.m. So ours is just 1 hour longer. All of these sites will be able to continue with pickup, takeout, and delivery services after 10 p.m. But the established dinings will close. And another really important thing that we want to talk about is the outdoor gatherings that will be taking place may only include 15 people who are members of no more than 3 households. So with that, let's talk a little bit about the holidays. As the holidays are coming, this is really a tough message. I understand it. I'm living it and experiencing it with you all, with my families. And the autumn and winter months are full of special times that we all really look forward to. Over the next few months, there are many secular and religious holidays that we usually spend with our friends and extended family members This pandemic has been very difficult and frustrating in many ways, including placing these limits on how we can celebrate safely. We do encourage each of us to think about how to modify our plans to share the joy of the holiday while reducing the risk of transmission during this dangerous time and really with a deadly virus. This may mean continuing to plan celebrations with members of your household, celebrating outdoors with 2 other households, and reaching out by phone and video with your friends and family members in other parts of the country. As you plan your holidays, please remember that while we're in this pandemic, the kindest thing we can do for one another is to protect each other from potentially becoming infected with the virus. Worship services need to be held outdoors and adhering to distancing, infection control, and face covering requirements. Please be sure to keep each other safe. It's difficult to face this season and holidays. And I know it's not what we want, but we just need to do all that we can to support each other, to keep each other safe, to avoid activities where we'll be in crowds, where it is hard to maintain a distance of 6 feet from one another. Please wear your mask coverings inside and outside as much as possible when you're not with your household. And make sure to follow all the rules at the businesses, work sites, and retail establishments. We do know it is frustrating right now, but we do strongly believe that if we take these actions, work together, both early in the pandemic, like we did early in the pandemic and during the summer months, we saw a change when we all worked together, and we believe we can do it again now. And just hope we can all work together and support this pledge that's taking place right now. Thank you.
Thank you so much, Noel, for emphasizing the pledge. Mayor Tim Sandoval, our local champion for innovation, for creativity. I hear a lot of hope and optimism, and I'd like to upshift here just a little bit because I'm very, very impressed with what has happened as the Pomona community has come together under these conditions. I look at our screens and I see brilliant minds like Miguel Santana, Jim Dale. I see the weight of Dr. Calderon. Talk to me, Mayor, about our local COVID-19 impacts, but most importantly, our collective solutions and how you've been championing that message.
Thank you, Oliver. I appreciate that. Before I say a few words, I do want to just pay special thanks to PUSD. I want to thank ICON, Julie and Rebecca. Thank you. I know that when we had spoken some time ago, your vision is coming to fruition, and I just want to say thank you for making this happen. It really speaks to the spirit of Pomona. And none of us can accomplish anything without each other. And through this tragedy, through this misery, you see this incredible hope of people coming together to try to heal and to help and to get people through these most difficult times. And so I just want to say thank you, Julie and Rebecca, for being here for Pomona. I also want to thank Tri-City as well. I mean, there's a lot more people to thank. There's certainly not a shortage, but I know you organized this, and just want to say thanks. You know, there are millions of untold stories of COVID-19 that we have yet to hear. We're going to be talking about this for a very, very long time. And it's one of those experiences where it's real for us, right? I mean, I remember in mid-March, shortly after we announced that the Fairplex, the Sheraton Fairplex was one of the first hotels that became a quarantine site in LA County. And how significant was that? In that it pushed other areas of the county to open up sites as well. And I remember getting a call from a young lady who was panicked and crying because she was living with her grandparents and she just found out that she had COVID-19. and had no idea what this meant. And there was this system in place that I could call, or that I could direct her to call, that helped place her in a hotel in downtown LA. And for 14 days, she was housed, she was taken care of, and she survived. And she could go back to her grandparents and be there and make sure that she could be there to help them. But we know the stories. We know the families that are struggling, whether it's to pay rent, whether it's to put food on the table, whether it's just the stress, right? The stress of having the kids at home and dad at home because perhaps he can't work or mom can't work, or older adult population who if you think of the group that's been highly impacted, who are isolated, which sometimes leads to depression. Think of our children, our small businesses, people who have saved up their life savings to open up a business, and they're not sure whether they're going to be able to stay open. And yet amidst all this pain, all this frustration, and let's be honest here, there's a lot of anger out there, right? And sometimes that anger gets lobbied and leveled at government. But I want everyone on the call to know that there are people who have been working in this community to make sure that to the degree that we can, that you're going to be okay. And so when Oliver had asked me to speak, I'll just briefly just share with you, shortly after it became clear that we needed to do something, I convened about 25 community leaders from both small and large organizations. So I grew to over 50 community leaders. And if you think of Fairplex and Cal Poly and school district and smaller organizations like the Pomona Economic Opportunity Center, Latino Roundtable, the NAACP, we didn't have the answers at that moment, but collectively, we've been working over the last 8 months to try to figure this out. And we've done some things, and I want to share just a couple of those with you. There's a lot more I could share, but I just want to share some of these with you because this was not a city of Pomona effort. This was a community-wide effort representing different constituencies, but really, really representing our residents and our small businesses. And so if any of you are brave enough to go onto our City of Pomona website, it's only one of the absolute best websites in the entire country. We're not there yet. We have a long ways to go. But you will find, and I really want you to share this with folks, but we have a rental assistance program right now that is at this point first come, first serve. And we are going to keep it open until all funds have been used. And we have 4 community-based organizations that are helping families fill out the application. And you will find those organizations on our website. We also have right now a small business relief program up to $5,000. We've already granted about, I think it's about over 50 plus businesses, $5,000 grants. There's more. And then we have a COVID-19 action, or say COVID-19 hotline number that you can call, and our staff will try to direct you to whatever resources that are available in the community. And that number is 909-620-2311, extension 0. And so I'll end by just saying that I'm as difficult as this has been, as challenging as this has been, you have seen people across this city, across this region come together to serve, to help, to lend a shoulder, to lift up a food box and get it to a family so that they can eat, to leaflet communities that perhaps don't always know what's happening in this city, right? In fact, this Saturday, a group of us will be walking into some of the most challenged neighborhoods, providing them this information that they can use to apply for this rental assistance program. And so I want to thank everyone. I want to again thank the school district and ICON and Tri-City for putting this on, because there's more work to be done. And I'm incredibly appreciative of all the amazing people in this city who are working together to try to help the different complex facets that COVID-19 has revealed. And I'm encouraged by what I see. So just want to thank you again for the opportunity to share that. Thank you, Yunaka. Back to you, Oliver.
Yeah, no worries. Thank you so much, Tim, for that. Patty, this is where the services, the support, the resources really come and a face is placed on them. If you would just share very briefly the school-based support and what we say here as a community here in the Pomona and Diamond Bar area, that there's no such thing as a wrong door. Whether they're going to the city, they're going to the Fairplex, they're coming to Pomona Unified School District. If there's a family in need of resources, especially during these times, during the pandemic, us coming together in this manner and really singing from the same sheet of music, we're able to redirect individuals in a very short period of time to get individuals right back on track. Can you just touch on that from a Pomona Unified School District standpoint and what those resources mean to families here locally?
Thank you, Oliver. Good evening, everybody. I love the thread of hope that goes through our conversations today, because I think we need to keep hoping on. We need to keep holding on to hope. It started with our superintendent talking about a message of hope, and the thread of hope has gone through each person's conversation. And even our high school students, they kind of are actualizing hope for all of us. And one of the things that we've been doing in our office since March 16th is to really reach out to our families and connect them to the services within the community, within our offices, within the district. As we all know, the pandemic has really had a detrimental effect on our students' mental health. We've seen them struggling with feelings of loneliness and depression and anxiety, the social isolation, the loneliness among our kids has really, increased their feelings of hopelessness. One of the things we want to do is to kind of continue to create that hope. So from our office, we've been able to connect our students who are in need of talking to someone, our families who are in need of working with a grief specialist because of loss, because of grief during this time, but also connecting them to our community agencies, such as Tri-City, and making sure that they're getting the help they need. And we've been trying to connect as many families as we can. We see the kids in the classroom who, are having a difficult time in the class, disengaging from class. They stop working. They may be losing their energy and motivation to be in the classroom. And we want to support the teachers as well. So we have a lot of different things going on in our office. Besides the mental health, we also have our family support program, where families come in and our schools are letting us know that families are in need of food, or they're in need of basic items such as shampoo or toothpaste, things like that, that would help in the home. We've also had families who someone in the home, especially mom or dad, has COVID and they're not able to get here. Some of my staff have been going out to the homes and delivering packages of food and items that they might need in order to, get well. We just had a parent who just requested paper plates and cups because she's ill, and washing dishes is the last thing she wants to do. And I think we need to take notice of that and help her out in any way we can. So one of the things, and I'll be brief here, Oliver, is to really encourage our parents to really increase their children's hope. If they can just start with one thing, that would be to start with more hopeful language in their conversation. And I think tonight we've heard a lot of hope. And I hope that parents take that back to their kids. Because I think we know what the research says about students who have hope. They have better grades, they show up for school, they are more engaged in class, they have stronger friendships. So if we can continue with this theme of hope, I think we can, with everything else, wearing a mask and staying 6 feet apart, we can help our kids understand what's going on. And we can also get our seniors to graduate on a platform, hopefully in May. So, and I'll stop there. Thank you.
Thank you so much for that, Patty. And what a great way to close out part two. That said, we're going to follow your lead, Patty. We're going to model hopeful language right here, right now. And Miguel Santana is going to start that out for us because he too represents hope. And Miguel, Tim mentioned something with regard to the Fairplex and the efforts that you and your team did there, which were no less than stellar. We so appreciate you and your team for that, and most importantly, your leadership during these trying times. So, in this hopeful note, this is going to be our rapid fire, and then I'm going to turn it back over to our students who are going to end on a hope note. So, Miguel, Los Angeles Fairplex, as I just mentioned, you're a critical community partner.
Well, it's Pomona Fairplex. That's Pomona Fairplex.
I'm sorry, Pomona Fairplex. Thank you. Thank you so much for that. Pomona Fairplex. Miguel, talk to us about what it means to be a critical community partner and how you all, as Patty just put it, provide the hope even during these times. And just share with us very briefly, if you wouldn't mind, just the resources that are available to the families who are still sticking around to hear this vital information.
Well, I'm hopeful because of all of you. This is an incredible community that has really come together at this critical time. When the crisis struck this community, the doors at Fairplex had to close. We had to dramatically reduce what we do. But we decided that this was really our time to give back in a way that we never have in our 100-year history. And so Supervisor Solis called me and asked if we would allow the county to make the hotel quarantine center. We didn't hesitate. We said absolutely, because this space is needed for our neighbors, for our friends, for our family. I get a front row seat of how COVID is taking shape in our community. It started off with only a handful of occupants of the hotel. The first guests were a group of firefighters who got COVID on the line of duty. And unfortunately, we see when the crisis is growing. Today, the census is almost at the peak of where it was in the summertime during the last peak. We're one of the first places to provide testing, as you heard. It's available for anyone, regardless of your immigration status, regardless of your where you live. We currently have done over 65,000 tests on our campus. Very proud to do that in partnership with the county and with the community. We also kept our childcare center open. Most childcare centers actually closed, and we decided to keep it open. Most families decided to keep their kids with them during the shutdown. And so we made it available for first responders and other essential workers who have to work, so to keep all of us safe. And we were able to raise money for these families. And then lastly, we've partnered with Sowing Seeds to turn our world famous drag strip, the birthplace of the NHRA here in Pomona, into a drive-through food pantry. Serving thousands of families every single month. We were proud to partner with the city of Pomona to do something around Halloween. It has really been the time that Fairplex has committed itself to doing good in the community, even as we ourselves have struggled and faced dramatic declines in our own revenue because because of the impact that the pandemic has had on us. So we're so proud to be part of this community. We're so proud that everyone has come together at this time of need. And despite it all, we're optimistic moving forward, even though we had to cancel this year's fair, which was very hard, but we're looking forward to a brighter future.
Thank you so much, Miguel. Really appreciate that. Tony, Patty touched on something. She talked about mental health as it related to many of our neighbors here and the thread of hope that's so important. Can you touch on the resources that are available at Tri-City Mental as a further glimmer of hope for our neighbors, for our students, for our families who are dealing with so many different circumstances during these trying times?
Thank you. Yes, I certainly can. And I just want to say it's an honor to be here tonight and to be a part of this panel. And I'm here to say that Tri-City is all in with the pledge and doing everything we can to not only take care of those who are in need with their mental and psychological and emotional health in this time, but also to stop the spread of COVID-19 in Pomona. And I want to start first with what we're, in this time, we've talked about everybody learning new skills and actually being part of new relationships and collaborating in new ways. And Tri-City was lucky enough to be contacted by Rebecca and Judy about ICON and the Stop the Spread presentation that Jessica did for us earlier, which is fabulous. And we have staff that are now trained in that and are ourselves holding meetings and groups for our clients and families to talk about Stop the Spread. One of the things we realized though early on in COVID is that we weren't just getting calls about need for mental health service. Our community navigator program was getting calls about PPE. People, economically, people have been struggling, and this new budget item that everyone has is PPE and disinfectant. We're talking a lot tonight about the way to stop the spread is to wear masks and to disinfect, to clean your homes, to have hand sanitizer when you're out in public. Those things are all costly, and they actually, across the United States, they've done surveys, and that's coming directly out of people's rent and food budgets. And people are foregoing food and rent, which is causing other anxiety to get the PPE and stay safe. So Tri-City has taken the lead on supplying drop boxes. All of our sites at Tri-City that provide direct services remain open with about 25% of staff on site every day, Monday through Friday, to provide assistance and triage. All of our clinical services are also done in telehealth form. But here, these three locations, our adult clinic, our wellness center, and our MHSA building across the street from our adult clinic are all open every day to accept donations. So there's two things that we're asking of the community in our role here. We've reached out to a lot of our partners and those who can and who are calling us and saying, how can we give back? How can we help? And we have drop boxes for people to drop off PPE. What then happens is when we get calls from the COVID-19 hotline from the city of Pomona or directly from our staff or from other community organizations, our teams will put together packs of disinfectant wipes for the home, cleaning disinfectant, boxes of masks, things that have been donated that are available to get to families so that they can stay well. In particular, there are families who are exiting the Sheraton Fairplex. Tri-City is on site there every day providing resources. And when we have families or family members who are exiting after their quarantine, going back home, we're making sure that they have supplies when they go home to stay safe. And so we want everyone to know that this is available to them. Speaking now just on the mental health piece, I just want to say, folks have touched tonight on, stronger together, but staying apart. We touched on the isolation. We touched on people being alone. And I want to talk about some of that hope that, Patty's talking about. Patty's right. We need to give hope to our kids. But sometimes as a parent in this time, you're just like, I don't even have it to give. And how do I do that? And I just want to have this number here for everyone to know that 24/7, there are licensed therapists, available to talk to you. And to help you get through an emotionally difficult time, to have a discussion with you about how to find hope. This is also the same number that you can call during our business hours if you need us to come pick up a donation fully PPE covered, very safely. You can leave it on, at your front door. We will pick up a donation, but we will also bring donations and needs to our families that from the donations that we have. So again, we are stronger together, 6 feet apart. And the hope is that we are all here. We are all in. We are here to help. This number is available 24/7. Also would like to say I have the honor of being part of the mayor's COVID-19 Action Committee and am the chair of the Health and Wellness Subcommittee, and want to remind everyone that a campaign that we put together early on in this pandemic was called Call for Pomona, really encouraging everyone in Pomona to call for people, friends, family, loved ones every day, just to check in, say hello, let them know they're not alone and that they're being thought of, especially now during the holidays when people may have to be separate from their family members. So again, I'm honored to be a part of this group. The city of Pomona is really coming together in a very special way. Thank you all.
Thank you so much, Tony. Patty, if you wouldn't mind just doing a quick commercial blurb for your division, we'd appreciate it.
Okay, quick commercial blurb. The Family Support and Resource Center, we are providing food and clothing and shoes and hygiene items. We also connect our families to different services within the community, assistance with housing, with job searches, with legal aid, motel vouchers. We try to utilize all of our community agencies as much as we possibly can. We work closely with United Way and Assistance League and Shoes That Fit. And I'm probably leaving out 6 other groups that we do. It's very easy. Just walk into our office here at 605 North Park Avenue, and we'll be more than happy to help you. We'll make sure you have hand sanitizer as you walk in. We'll also provide cleaning items for you to take home and anything else you might need. I hope that was a quick and down and dirty.
Perfect, Patty. Thank you so much. Caitlin and Alex, you have a very special closing presentation for us, and I'd like to yield to you both for that.
Yes. So what we have done is that although these are only 2 students' faces that you're going to be seeing, we also have compiled a video of other students that you will also be seeing who are in to stop these spread. So if we can get the video going, that would be nice.
Village Academy.
I am in. I am in.
I am in. I am in.
I'm in.
I am in. I'm in. I am in. I'm in. I am in. I am in. I am in. I am in. I'm in. I am in.
Hello, this is Mr. B. Tony.
Mr. B, are you in?
I'm in if you're in.
I'm in.
I'm in.
We're in.
Gary High School, are you in?
I'm in.
I'm in.
I'm in. I'm in. I am in. We're in.
I am in.
I'm in. I'm in. I'm in. I am in. I am in.
I am in.
I am in.
I'm in.
I'm in. I'm in.
Good afternoon, Gary High School. How may I help you? Yes, to Mr. Black. One moment.
Hello? Yeah, of course, I'm in.
Pomona High School, are you in?
I am in.
I am in. I am in.
I am in. I am in.
I am in.
I am in.
I am in. I am in.
I am in.
Denisha High School, are you in?
I am in.
I am in. I'm in.
I'm in.
I am in.
I am in.
I'm in.
Diamond Ranch High School, are you in?
I'm in.
I am in. I am in.
I'm in.
I am in.
I am in. I'm in.
I'm in.
I'm in.
I am in. I am in.
I am in.
I'm in.
I am in.
I'm in.
So although we only are able to see two students on the camera, there's a bunch of other people who are able to stop the spread, and a bunch of other students who are waiting to get back to school. So with that being said, we are now going to ask some of the panelists, are they in? Are you guys ready to stop the spread?
We are in.
All in.
I'm in, all in.
I'm in. Totally in.
In.
I'm in.
We're all in.
I'm in.
I'm in.
I'm in.
I'm in.
I'm in.
Caitlin and Alec, thank you both so very much. I'm going to take this time to thank some individuals who helped put this on behind the scenes. You may not have saw their faces, but you certainly are seeing their efforts. And I want to start with Dr. Christina Walks-Harper. Thank you so much for lending the resources of your division. Sony, thank you so much. I know she has her camera off. Sony, you've been amazing, sending the links out to everyone. Haley Chacon, we couldn't do this without you. Grace Greenleaf, you've been so busy, and we're so grateful to you for translating in Mandarin to our families. Certainly appreciate that. Dr. Mark Main, for your consistent excellence. Shirley Martinez, you fell and got retirement, but you're doing a wonderful, wonderful job for us, and we thank you. Sylvia San Martin, thank you so much. Your efforts, you're all over the place, ubiquitous, and you're just helping us create a sense of place during this pandemic. Gino, couldn't do this without you, my friend. And last but certainly not least, Dennis Rivera. I also want to shout out our principals and administrators who've been sending text messages throughout the course of this event. We mentioned earlier on the principal's call, you all are doing a tremendous job in creating a virtual sense of place. And that means so much to us, having our families engaged and really understanding where the superintendent is taking this message and conveying this sense of hope throughout the community. We thank you so much for relaying that message, lending your faces to the I'm In campaign, which has gone viral, by the way. Thank you so much for that. And we would encourage each and every single person on this call, if you haven't already, and Sony will make this link available, we ask you to sign the pledge that the superintendent has been promoting over the past week. And if you feel so inclined, please add your face to it, and we will be sure to provide you a social media badge, and we will promote your face on our social media sites, and we ask that you do it on yours. Thank you so much. And Mr. Martinez, it's all yours, sir.
Oliver, I want to thank you on behalf of this community. You've done a great job at moderating this event. So thank you. Let's give him a quick round of applause. Those on the panel, we thank you for your support. Every time I see our students on the monitors, it's very emotional because we don't get to see you in person. So thank you. Thank you, Caitlin, for the hope that you do and you provide. Alec, we thank you for what you've done in the last few months on our board. You have done so much to brighten our days. So you are the hope and the inspiration, along with every student that we saw on video and every student that we see in other videos that our principals have been able to load up. We are so happy that they are able to capture them and promote our youth because we're resilient. And in spite of the pandemic, we will overcome this and we'll do well collectively. So again, thank you, community. Thank you for all those that attended, all those that participated, our leaders, our doctors, our health professionals. We appreciate you. First responders, you are lifesavers and you are heroes. So we thank you for all you do every day.
And
Have a
Mr.
wonderful
Martinez,
evening.
I made a gaffe. I saved the absolute best for last. Crystal, I've saved you. Thank you so much for the Spanish translation.
Yes.
Everyone have an amazing night.
Have a good night.
Thank you. Thank you, Oliver.
Thank you. Good night.
Thank you all.
Fantastic.
Thank you.